In a world where medical advances are constant, one cancer is defying the trend, striking harder and younger than ever before. Colon cancer, once considered an older person's disease, is now sending shockwaves through the medical community as cases surge among people in their 30s and 40s. What I'm about to share with you isn't just information, it's a wake-up call that could save your life. In the next few minutes, you'll discover the critical warning signs that too many people ignore until it's too late, and the essential steps you must take to protect yourself and your loved ones. The numbers are stark and sobering. Colorectal cancer now stands as the third most diagnosed cancer worldwide and the second leading cause of cancer deaths. But here's the crucial part: when detected early, the survival rate exceeds 90%. Pay close attention, this information could be the difference between life and death. Misconceptions about colon cancer risk. There's a dangerous myth that needs to be shattered immediately. Many believe they're safe from colon cancer simply because it doesn't run in their family. This false sense of security is putting countless lives at risk. Here's the stark reality: genetic factors account for merely 5 to 10% of all colorectal cancer cases. This means that 90 to 95% of cases are influenced by factors within our control: our daily habits, choices, and lifestyle decisions. As leading oncologists often emphasize, genes may load the gun, but lifestyle pulls the trigger. This powerful metaphor perfectly encapsulates the truth about colon cancer risk. While your genetic makeup plays a role, it's your everyday choices that predominantly determine your risk level. Your diet, physical activity, smoking habits, and even stress management have far more impact on your colon cancer risk than your family history. Early development of colon cancer. Colon cancer doesn't announce its arrival with dramatic symptoms. Instead, it begins its journey silently, often starting as tiny, harmless-looking growths called polyps on your intestinal wall. These small clusters of cells, invisible to the naked eye, can slowly transform from benign to potentially lethal over time. What makes this particularly dangerous is the stealth nature of its progression. These polyps can grow and evolve for years, sometimes even decades, without triggering a single warning sign. By the time noticeable symptoms appear, the disease may have already advanced significantly. This is precisely why medical professionals strongly advocate for preventive screening. For most adults, colonoscopy screening should begin at age 45. However, if you have a family history or other risk factors, your doctor may recommend starting even earlier. Remember, these screenings aren't just tests, they're your first line of defense against a disease that thrives on going undetected. Understanding right-sided colon cancer. Right-sided colon cancer presents a unique challenge in detection due to its location and the nature of digestive processes in this area. This section of the colon primarily handles liquid waste, creating a perfect environment for cancer to grow undetected for extended periods. The key characteristic of right-sided colon cancer is its subtle presentation. Because the content in this area is largely liquid, tumors can grow significantly without causing obvious obstruction or noticeable changes in bowel habits. This makes early detection particularly challenging. One of the most significant dangers is internal bleeding. As tumors develop, they can cause slow, chronic blood loss that's often invisible to the naked eye. This gradual blood loss typically leads to iron deficiency anemia, unexplained fatigue, weakness, pale skin, shortness of breath with minimal exertion. The blood and stool from right-sided tumors is usually not bright red but instead appears dark and mixed within the stool, making it harder to detect visually. This emphasizes the critical importance of regular screening, as waiting for visible symptoms might mean missing crucial early detection opportunities. Understanding left-sided colon cancer. Left-sided colon cancer typically presents with more noticeable symptoms compared to its right-sided counterpart, primarily due to the nature of waste material in this section of the colon. In this region, stool is more solid and formed, making obstruction more likely and symptoms more apparent. The key characteristics of left-sided colon cancer include distinct changes in bowel habits, noticeable constipation, alternating patterns of constipation and diarrhea, increased urgency to defecate, observable stool changes, narrow, pencil-thin stools due to partial blockage, bright red blood in or on stool, visible changes in stool consistency. The solid nature of feces in the left colon means that as tumors grow, they're more likely to cause immediate obstruction. This leads to earlier, more obvious symptoms that often prompt patients to seek medical attention sooner. Common signs include abdominal cramping, visible bleeding, and changes in bowel movement frequency. These more obvious symptoms can be a blessing in disguise, as they often lead to earlier detection and treatment, potentially improving outcomes. Key symptoms of colon cancer, early indicators. Early detection of colon cancer is crucial for effective treatment, and recognizing initial symptoms is vital. One of the primary indicators is chronic changes in bowel habits, such as persistent constipation or diarrhea, particularly when these alternately occur without an apparent cause. Another significant early symptom is the change in stool appearance, specifically thinner or ribbon-like stools. This may indicate a narrowing of the bowel due to the growth of a tumor. Patients who notice these changes should be vigilant and seek medical advice promptly. Early intervention can lead to better outcomes, making awareness of these subtle signs essential for individuals regarding their digestive health. Regular screening and consultation with healthcare professionals are strongly advised. Advanced warning signs of colon cancer. When colon cancer progresses, the warning signs become more pronounced and urgent. The presence of blood in your stool is a critical red flag that demands immediate medical attention. This can appear as bright red blood on toilet paper or in the bowl, or as dark, tar-like stools indicating bleeding higher in the digestive tract. Persistent abdominal discomfort becomes more prevalent as the disease advances. Gas buildup caused by partial bowel obstruction leads to significant pain, cramping, and a feeling of fullness that doesn't resolve after bowel movements. This is often accompanied by noticeable abdominal swelling or bloating. Perhaps most concerning are the systemic effects, unexplained weight loss despite normal eating habits, and profound fatigue that doesn't improve with rest. These symptoms indicate your body is actively fighting the disease, depleting your energy reserves and affecting your overall health. Don't wait or rationalize these symptoms away. When these signs appear together or persist, they warrant urgent medical evaluation. Early intervention can make a critical difference in treatment outcomes. Types and locations of colon cancer. Colon cancer, a significant health concern globally, varies in its presentation and impact depending on its location within the large intestine. Broadly categorized into right-sided and left-sided colon cancer, each type exhibits distinct symptoms and potential complications, making an understanding of their differences crucial for early detection and effective treatment. Right-sided colon cancer. Right-sided colon cancer occurs in the ascending colon, which is the first part of the colon where liquid from the small intestine is processed. This location influences the subtlety of the symptoms because the feces here are typically still in liquid form. As a result, tumors in this part of the colon might grow large and cause problems only when they are quite advanced. One of the hallmark signs of right-sided colon cancer is anemia caused by chronic, unnoticed blood loss, as the bleeding is often occult, meaning it isn't visible in the stool but detectable only through medical testing. Patients might also experience unexplained weight loss, fatigue, and a general feeling of discomfort or pain in the abdomen, often dismissed until more serious symptoms emerge. Left-sided colon cancer. In contrast, left-sided colon cancer is located in the descending colon, where the stool becomes more solid as it progresses towards the rectum. Tumors in this area are likely to cause partial or complete bowel obstructions, making the symptoms more apparent and often prompting earlier diagnosis. Common signs include dramatic changes in bowel habits, such as alternating constipation and diarrhea, noticeable changes in stool caliber, narrow stools, and visible blood or mucus in the stool. Additionally, patients may experience cramping pain in the lower left side of the abdomen, which can be severe as the obstruction worsens. Understanding these distinctions is vital for recognizing potential warning signs of colon cancer and for guiding appropriate diagnostic and treatment strategies based on the tumor's location. Early detection remains key in improving survival rates and outcomes for patients facing this challenging disease. Key symptoms to watch for in colon cancer. Colon cancer is a formidable health issue that often progresses silently, making awareness of its symptoms crucial for early detection and treatment. The disease manifests a range of symptoms that can vary in intensity and frequency, depending on the stage of the cancer. These symptoms can be categorized into early signs, advanced symptoms, and indicators of metastasis. Recognizing these symptoms can facilitate timely medical intervention, potentially improving outcomes and survival rates. Early symptoms. The initial signs of colon cancer are often subtle and can be easily overlooked, which is why vigilance is essential. One of the first signs to watch for is chronic changes in bowel habits. This includes new patterns of constipation or diarrhea, particularly when these changes last for more than a few days. Such alterations can indicate blockages or functional changes in the colon due to tumor growth. Another early symptom is a change in the appearance of the stool. Stools may become thinner or take on a ribbon-like shape, suggesting a possible obstruction in the colon. This change can also be accompanied by a sense of incomplete evacuation after a bowel movement, which should prompt further investigation by a healthcare professional. Advanced symptoms. As colon cancer progresses, the symptoms typically become more pronounced and may include both visible and occult bleeding. Bright red blood on the stool or toilet paper is often a sign of bleeding in the lower colon or rectum, whereas darker blood or black stools can indicate bleeding higher up in the colon. Both instances require immediate medical attention. Abdominal pain and gas buildup are also common as the tumor grows and exerts more pressure on the surrounding organs and tissues. This can lead to significant discomfort and cramping. Associated symptoms may include abdominal swelling and bloating, which are caused by the accumulation of gas and shifts in the body's ability to process and eliminate waste. Unexplained weight loss and fatigue are further advanced symptoms of colon cancer. These occur due to the body's increased energy expenditure to fight the cancer and the decreased ability to absorb nutrients properly. Metastasis indicators. If colon cancer is not detected and treated in its early or localized stages, it may spread, metastasize, beyond the colon to other parts of the body. Common sites for colon cancer metastasis include the liver and lungs. Liver metastasis can lead to additional symptoms such as increased abdominal pain on the right side, a palpable mass under the ribs on the right side, jaundice, yellowing of the skin and eyes, and general liver dysfunction. When the lungs are affected, symptoms might include chronic cough, shortness of breath, and chest discomfort. These symptoms arise as the cancer impairs lung function, leading to decreased oxygenation and respiratory complications. Awareness and recognition of the early signs, advanced symptoms, and metastasis indicators of colon cancer are key to prompt diagnosis and treatment. Anyone experiencing these symptoms should consult a healthcare provider for a thorough evaluation and appropriate diagnostic tests. Early detection remains the most effective strategy for successfully managing and treating colon cancer, highlighting the importance of regular screenings and vigilance regarding one's health. Key symptoms to watch for in colon cancer. Colon cancer is a formidable health issue that often progresses silently, making awareness of its symptoms crucial for early detection and treatment. The disease manifests a range of symptoms that can vary in intensity and frequency, depending on the stage of the cancer. These symptoms can be categorized into early signs, advanced symptoms, and indicators of metastasis. Recognizing these symptoms can facilitate timely medical intervention, potentially improving outcomes and survival rates. Early symptoms. The initial signs of colon cancer are often subtle and can be easily overlooked, which is why vigilance is essential. One of the first signs to watch for is chronic changes in bowel habits. This includes new patterns of constipation or diarrhea, particularly when these changes last for more than a few days. Such alterations can indicate blockages or functional changes in the colon due to tumor growth. Another early symptom is a change in the appearance of the stool. Stools may become thinner or take on a ribbon-like shape, suggesting a possible obstruction in the colon. This change can also be accompanied by a sense of incomplete evacuation after a bowel movement, which should prompt further investigation by a healthcare professional. Advanced symptoms. As colon cancer progresses, the symptoms typically become more pronounced and may include both visible and occult bleeding. Bright red blood on the stool or toilet paper is often a sign of bleeding in the lower colon or rectum, whereas darker blood or black stools can indicate bleeding higher up in the colon. Both instances require immediate medical attention. Abdominal pain and gas buildup are also common as the tumor grows and exerts more pressure on the surrounding organs and tissues. This can lead to significant discomfort and cramping. Associated symptoms may include abdominal swelling and bloating, which are caused by the accumulation of gas and shifts in the body's ability to process and eliminate waste. Unexplained weight loss and fatigue are further advanced symptoms of colon cancer. These occur due to the body's increased energy expenditure to fight the cancer and the decreased ability to absorb nutrients properly. Metastasis indicators. If colon cancer is not detected and treated in its early or localized stages, it may spread, metastasize, beyond the colon to other parts of the body. Common sites for colon cancer metastasis include the liver and lungs. Liver metastasis can lead to additional symptoms such as increased abdominal pain on the right side, a palpable mass under the ribs on the right side, jaundice, yellowing of the skin and eyes, and general liver dysfunction. When the lungs are affected, symptoms might include chronic cough, shortness of breath, and chest discomfort. These symptoms arise as the cancer impairs lung function, leading to decreased oxygenation and respiratory complications. Awareness and recognition of the early signs, advanced symptoms, and metastasis indicators of colon cancer are key to prompt diagnosis and treatment. Anyone experiencing these symptoms should consult a healthcare provider for a thorough evaluation and appropriate diagnostic tests. Early detection remains the most effective strategy for successfully managing and treating colon cancer, highlighting the importance of regular screenings and vigilance regarding one's health. Detection and diagnosis of colon cancer. Early detection and diagnosis are crucial in effectively managing and treating colon cancer. Two primary methods are employed to detect this disease: stool sample testing and colonoscopy. Each tool serves specific purposes in the proactive screening and early intervention for colon cancer. Stool sample testing. Stool sample tests are a non-invasive screening option primarily used to detect occult, hidden, blood in the stool, which may not be visible to the eye but can be indicative of polyps or colorectal cancer. The fecal immunochemical test, FIT, is commonly used for this purpose. It involves taking a small sample of stool at home, which is then sent to a laboratory for analysis. Positive results suggest the presence of blood, warranting further examination via colonoscopy. A colonoscopy is a more comprehensive procedure that allows direct visualization of the internal lining of the colon and rectum. This is done using a colonoscope, a long, flexible tube equipped with a video camera at the end. It is inserted through the rectum and advanced through the colon. The high-definition camera provides live images, enabling the detection of polyps, cancers, and other abnormalities. During a colonoscopy, any detected polyps can be removed on the spot using special tools passed through the colonoscope. This not only helps in diagnosing cancer, but also removes polyps before they have the chance to turn into cancer. Removed polyps are sent to a lab for biopsy to determine if they are benign, precancerous, or cancerous. Recommended age and frequency for screenings. The American Cancer Society recommends that individuals at average risk of colon cancer begin regular screenings at the age of 45. Those with a personal or family history of colon cancer may need to start earlier. The frequency of screenings depends on the initial results. Typically, a colonoscopy is recommended every 10 years if no abnormalities are found, or more frequently if polyps are detected. Comfort during procedure. To ensure comfort and ease for patients during a colonoscopy, sedation is commonly administered. This helps patients relax and often sleep through the procedure, making it painless and quick. Sedation safety and monitoring are paramount, with medical staff present to ensure the well-being of the patient throughout the procedure. Through these diagnostic tools, particularly colonoscopy, early detection of colon cancer is highly achievable, significantly improving treatment outcomes and survival rates. Risk factors for colon cancer. Colon cancer, a significant health threat, is influenced by various risk factors that span dietary habits and lifestyle choices. Understanding these risks is crucial for prevention and early detection. Dietary triggers. A diet high in ultra-processed foods, red meats, such as beef and pork, and processed meats, like sausages and deli meats, significantly increases the risk of colon cancer. These foods are often rich in unhealthy fats and chemicals used in processing, which can promote cancer growth. Additionally, diets that are high in sugar and sodium contribute to obesity and inflammation, further escalating the risk of developing colon cancer. Other contributing factors, beyond diet, lifestyle factors play a significant role in colon cancer risk. Chronic inflammation, often exacerbated by poor dietary choices, can damage colon cells over time. An imbalance in gut flora, possibly due to excessive antibiotic use or poor diet, also affects colon health adversely. Furthermore, alcohol consumption and smoking introduce toxins into the body, compounding the risk of mutations that may lead to cancer. Addressing these risk factors through better dietary choices and healthier lifestyle habits can significantly reduce one's risk of developing colon cancer, underscoring the importance of awareness and proactive health management. Preventative measures for colon cancer. Preventing colon cancer involves a multifaceted approach that includes dietary modifications, lifestyle changes, and informed decisions regarding overall intestinal health. Understanding and implementing these strategies can significantly lower the risk of developing colon cancer, a disease that remains a major global health concern. Dietary recommendations. Diet plays a critical role in the prevention of colon cancer. Consuming a diet rich in anti-inflammatory and antioxidant-rich foods is paramount. Fruits and vegetables, such as berries, leafy greens, and cruciferous vegetables like broccoli and cauliflower, provide essential nutrients and antioxidants that protect cells from DNA damage. Turmeric, known for its active ingredient curcumin, has potent anti-inflammatory properties and has been shown in numerous studies to inhibit various types of cancer cells, including those of the colon. Healthy fats, particularly those rich in omega-3 fatty acids, are another critical dietary component. Sources like fatty fish, salmon, mackerel, flax seeds, and avocados help combat inflammation, an underlying factor in cancer development, and also support overall cellular health. These fats not only reduce inflammation, but also enhance the absorptive functions of the digestive tract, aiding in the absorption of vital nutrients. Hydration and fiber intake are indispensable for maintaining a healthy digestive system. Adequate water intake ensures that the digestive system is sufficiently lubricated and aids in the smooth passage of waste. Fiber, found in whole grains, legumes, fruits, and vegetables, is essential for healthy digestion. It helps to keep the bowel movements regular and scrubs the intestinal walls, removing waste and potentially carcinogenic substances from the colon. Lifestyle habits. Regular physical activity is highly beneficial in reducing the risk of colon cancer. Exercise helps to maintain a healthy weight, improves immune function, and stimulates regular bowel movements, reducing the intestinal dwelling time of potential carcinogens. Sufficient sleep and engaging in social activities also contribute to overall health and help mitigate stress, another risk factor for cancer. Intestinal health. It is essential to address myths concerning the consumption of seeds and nuts. Contrary to popular belief, seeds and nuts do not increase the risk of diverticulitis and are, in fact, beneficial for intestinal health. They are rich in fiber and healthy fats, which are critical for maintaining the integrity and function of the digestive tract. Regular consumption of these can contribute positively to colon health and help prevent the onset of colon cancer. By adopting these preventative measures, individuals can significantly reduce their risk of developing colon cancer and promote a healthier, more resilient digestive system. Importance of colonoscopies. Colonoscopies are a critical diagnostic and preventive tool in the fight against colon cancer, offering a direct method for observing the inner lining of the colon and rectum. This procedure uses a flexible, camera-equipped tube called a colonoscope, which is carefully inserted into the rectum and guided through the colon. The high-resolution camera at the tip of the colonoscope provides a clear view of the colon's interior, enabling physicians to identify any abnormalities such as polyps, ulcers, or tumors. One of the key advantages of a colonoscopy is its dual functionality. Not only does it allow for the visualization of the colon, but it also enables the removal of polyps during the same procedure. Polyps are growths on the lining of the colon which, if left untreated, could potentially develop into cancer. During a colonoscopy, these polyps can be snipped away and subsequently sent to a laboratory for histological analysis, helping to determine whether they are benign or precancerous. When it comes to safety, colonoscopies are considered to be very safe procedures with minimal risks. Complications are rare, but can include perforation of the colon walls or adverse reactions to the sedatives used during the procedure. However, these risks are generally low when the procedure is performed by experienced gastroenterologists. The importance of colonoscopies cannot be overstated, particularly as a preventive measure against colon cancer. Regular screenings, as recommended by healthcare providers, can dramatically reduce the incidence of colon cancer by enabling early detection and removal of precancerous polyps, thus potentially saving lives. Understanding and participating in regular screening can significantly reduce your risk of colon cancer and truly save lives. We encourage everyone to stay vigilant about the symptoms discussed today and to consult a healthcare provider if you notice any changes. Please share this video with your friends and family to spread this vital information even further. Awareness is powerful and can lead to early detection, which is key in effectively combating colon cancer. If you're interested in learning more about this topic, stay tuned for our upcoming video on hidden signs of cancer, which will delve into lesser-known symptoms that should not be ignored. We value your thoughts and personal experiences. Comment below to join the conversation. Your story could provide support and inspiration to others navigating similar challenges. Let's keep the dialogue going and continue to support each other in promoting health and awareness.